Fantastic. Here we go.
Hey, welcome.
Hey, everybody. Dr. Schilling with
Dr. Jess.
Dr. Jess here,
Hey.
Secoya Health, and we're bringing a brief video on thyroid health. So we're going to rip through these guys because you want information, you want to know what to do in a very short period of time.
Yep.
So here's what we're going to do. We're going to talk about 5 things you need to know. Most likely your doctor doesn't know how to test this, so you need a comprehensive panel, right?
Yep. Absolutely.
You've done it before, I've done it before, so get some more information.
Yep.
Thyroid needs to work, it might be working just fine because where is your thyroid hormone converted?
It's in your gut and your liver.
In your liver, right, exactly. So
Yep.
if those two aren't functioning well, nothing's going to happen.
Yep. All
right, stress and emotions can limit your thyroid. So if you feel powerless and or don't have a voice in your life or in your relationships, guess what's going to happen?
It's going to affect your thyroid function.
Party's over.
Yep.
Right? All right. So your water could actually be killing off your thyroid. Now, how does that work? Right? What do they put in water?
What do they put in water?
Fluorine.
Yep.
Fluoride for your teeth.
Yep.
And chlorine to disinfect the water. And then you drink sodas and there's bromine in there. And those will all shut down your thyroid because those are halogens. Okay? All right. So fatigue is actually a symptom, right?
Yep.
So we talked about this earlier. So
Yep.
give them a breakdown.
Yep. So a lot of times people come into the clinic and one of the biggest complaints that they have is fatigue. And so one of the first places that we go looking is often at what the thyroid is doing or how it's functioning. And so often we'll just check your lab levels. And again, a comprehensive panel. We're not just looking at your TSH and your T4, for example. We're going to look at everything, how it's functioning.
Yep. And your thyroid hormones will turn on your cells. And with your mitochondria in your cells, you get 50 trillion cells. If those are working and they're producing energy because your thyroid's turning the key in the ignition, then you have energy. Okay? Here's 5 things you can do right now to start improving your life. Okay? Start off with running a comprehensive panel. Dr. Jessica just talked about this, right? Find out what your reverse T3 is. Find out what your T4, free T3.
Yep.
And don't just limit it to the balance between TSH and T4 because that's not giving you the accurate picture.
Yep.
All right. So then what we have is eating foods for your thyroid, right? We have selenium from Brazil nuts.
Yep.
You can eat seafood.
Yep.
Right?
Seafood with
Specifically kelp.
Kelp. Yep.
Kelp. Yeah, you want to eat something with iodine in it, right?
Yep.
You can eat things that contain zinc, almonds, and things of that nature.
Eggs. Yep.
Eggs, yep.
Yep.
We talked about that.
Yep.
All right. So eat for your thyroid health.
Yep.
Speak your voice, right? QNRT is a great tool we use in the clinic here to give people a voice because they understand their patterns and where they're coming from, so they can break free, use their voice, step into their power, and no longer be limited, right?
Yep.
That's a great feeling. All right. Then we want to reconsider your meds or your doses, right?
Yep. Check a lot about like levothyroxine. So a lot of people come in and they're already taking that, and so a lot of times if we're identifying what the root cause is of reasons for the abnormal or low functioning thyroid levels, looking specifically at the TSH, oftentimes, or excuse me, the high number of TSH, we give you levothyroxine to bring that number down, but it's not really correcting or addressing the root cause of the problem. So so we want to take a look at your medications, do a good thorough history, and talk to you about where you're at and where you'd like to be.
Absolutely. And if you take a thyroid medication like Levo or Synthroid, basically if you're not converting your synthetic medication in your liver and your gut, you are basically having a big bonfire with a bunch of logs, but you have nothing to start it with. And if you can't light it up with your thyroid hormone, you can't have a fire. All you're doing is putting more logs on a fire you can't start. So that'd be wasting your time, your energy, and you're actually putting a synthetic drug in your body, which then you have to detoxify, which will only slow you down further. Okay. Last but not least, we want to boost your immunity and your nutrition and your thyroid through IVs and
Supplements,
right? Here's a couple of them here.
Yep.
Brief synopsis: you got thyroid health, detox support, hormonal support, methylation support, things like that. So understand that there are things you can do. I'll give you that synopsis again. 5 things you can do, 5 things you need to know. Feel free to give us a call, let us know how we can help, and know that today it can be the first day of your new life when you take action. All right?
Yeah,
All right.
sounds good.
Have a
Have
good
a great
day.
day. Bye.